Let's begin by bringing you the overall India figures and as they stand as of last 24 hours. And this is the map right here for you. 56,211 new cases have been added to the overall tally. And look at the tally, the troubling number of over a crore there. Now, number of deaths, it went up by around 271. All this is happening. These figures in red that you see is of the last 24 hours. This map that you see over here, these about 8 to 10 states that have been marked in red have the maximum cases in the country right now. The moderate ones in orange and the green, which have the least amount of cases at this point. The total vaccination as we speak right now has also gone over 6 crore and 11 lakh. But that's simply not enough. India needs to amp up that number quite significantly. Let's look at the next graphic now and look at the states which have been contributing the most to these figures. We've got Maharashtra, no surprises, over 30,000 cases. Punjab, 2,800. Karnataka, 2,700. Madhya Pradesh, 2,300. Tamil Nadu, about 2,200 as well. And Kerala there has gone off the chart, if you'll see from the previous day. Let's look at the deaths. Maximum of them coming in from Maharashtra again, 102. Punjab, 59 over there. And look at the comparison versus the death percentage there versus the number of cases that are coming in these states. So Punjab, a huge worry at this point. Is it the new variant alone? That is what we'll be talking about on the show as well. Chhattisgarh, about 20 lives lost. Karnataka, 16 and Tamil Nadu, 14. All this in the past 24 hours. Let's look at the next graphic now. And this tells you about India's positivity rate that is now doubling and has doubled almost in 4 weeks alone. Now, 4 weeks ago, it was about 2%. 2 weeks, it got to 2.9. 1 week ago, it was about 3.7. And now look at that number. Today, on the 29th of March, 5.3%. That's the positivity rate. That tells you that it's not just specific pockets that we are looking at where numbers are spiking up, but overall in the country, we are seeing the coming in of a second wave altogether. Let's look at the next graphic to actually put in perspective for you the world and how India sort of positions in that. Now, India at the moment has the second highest daily number of cases that are coming in. Now, US at the moment is reporting daily cases about 68,000. They're obviously top of the chart over there. India only second, 56,000. Brazil, after having a harrowing time really with the second wave, stand at about a significantly lower 38,000. Then it's Italy still dealing with the virus there, 12,000, almost 13,000 there. France, 9,100. Russia, 8,500, and at number 7 is UK at about 4,700 at the moment. These are all daily cases, of course, and these are reports in the past 24 hours. All right, so this is what the overall figure in the country really is looking like. On the program for you, we've broken it up into 2 parts. One, where we talk about and we take you inside India's COVID hotspot, which is Nagpur. We'll talk about that and then we'll figure out in the second half of the program into what exactly needs to be done in other places as well. So NDTV has been looking at reports that have been coming out from various places. One particular report from Telegraph also pointed out how medical staff struggling at this point to cope with the growing numbers. Staff are dealing with numbers that are way beyond their capacity. Keep looking at these visuals while I'm talking to you. This is all courtesy Joe, by the way, who will be joining us on the program shortly from Telegraph UK. And this is the condition inside 2 of the most busy hospitals in Nagpur at this point. At this point, in about mid-Feb, there were about 20 people being admitted in these hospitals daily. Now, about 50 to 60 every day. Apart from that, social media has been awash by several pleas that have been coming in from Nagpur's 2.4 million residents desperately searching for beds for their ailing loved ones and not being able to find that. And why is that? Because more and more virologists and doctors at this point are talking about a new variant, a much more transmissible variant which is getting out of control. Now, India, of course, has been talking about these variants as well, if you'll remember, but the ministry, the genome sequencing that we do is quite minuscule. India has been able to sort of genome sequence or get a fingerprint of all these digital fingerprints of these new variants only about a 0.1% really. So is this enough, and is there now more and more growing evidence about what needs to be done at this point? Now we're very delighted to have Joe joining us on the program now. Welcome to NDTV, Joe. Thanks for your time. We've been looking at the spectacular, brilliant piece that you wrote for Telegraph and your experiences of being in Nagpur, trying to understand the entire issue in detail. First up, I wanted to understand from you, you reported on this over the weekend. I understand at that point what exactly were the sights and sounds of these hospitals. You've talked about how breathless people were actually queuing up outside hospital and there are simply no beds left.
Hi, Sonal. Firstly, thank you so much for having me on the show. And I guess it's to talk about a very sobering topic. I travelled to Nagpur on Friday morning. I visited several hospitals in the city, 7-star and Viveka. And the situation is very, very critical. We've seen a huge surge in cases. Nagpur recorded over 4,000 cases now on Friday, and there simply isn't enough hospital beds to go around for patients. Now, under the rules set by the city authorities, if you are symptomatic, you have to be admitted into hospital. And there are queues of patients outside triages. I think you mentioned there, they've gone from a month in 7-star from having 20 patients inside the hospital to having 50, 60 arriving a day. In Viveka, they doubled the capacity of hospital beds from 30 to 60. This is on March the 10th. And the CEO of the hospital told me that those extra 30 beds were filled up within the hour, which gives you an idea of the need and quite the severity of the second wave.
Right. And do you have an idea of what is the age group of people mostly who are landing up in hospitals right now?
So I think this has been one of the key points that the doctors wanted to raise about the second wave is that we're still seeing the majority of patients who are elderly or possessing comorbidities, but they've seen a massive spike in young patients, those below the age of 45, compared to the first wave. And now certainly it's a factor that some of these patients are delaying getting tested. There's some kind of COVID-19 fatigue, but doctors don't believe that this can be a reason alone, and that they're seeing more young patients with severe symptoms that need longer hospitalisation, and they're just urging the citizens in Nagpur to adhere to those precautions and to get a test if they develop any symptoms at all. I think there's Kingsway Hospital in Nagpur. Roughly 25% of those admitted are below the age of 40. Whereas they only had a couple of patients.
That's a huge number.
First wave. As you say, it's really significant.
So you're saying what you saw in Nagpur was more of young people coming in. Young people are obviously taking longer to fight out the virus as well, and the medical infrastructure clearly crumbling under that load of patients as well. Now, talk to me about the other big factor that was talked about in your report, that is about this new variant. What exactly is driving up this surge? And you say there is more and more evidence being talked about, at least in the hospitals, not at the ministry level, of course, because here in Delhi, in the national capital, they're not talking about and they're not putting it down to the new variants completely. But you're saying more evidence on the ground that this is a much more contagious mutant that we're talking about.
Absolutely. I mean, you've hit the nail on the head there. I think with the studies that we do have from the Indian government, they're really concerning. 80% of the 401 samples collected in Punjab between January and March 10th were positive for the UK variant, which studies have shown can be up to 70% more contagious. We have over 200 cases of the double mutant now in Maharashtra, which contains 2 variations in itself. The first makes it more contagious, and the second means that it can reinfect patients who've already had the virus, which is what we're seeing across India. People are coming down with COVID for a second. Now, the health experts calling on the Indian government, what they say needs to be done as priority is that all of these variants need to be tested. There needs to be more knowledge of how widespread they are, particularly in kind of the densely populated cities where kind of a more contagious variant can spread. And I think the key thing here is that the official reason for the second wave seems to be that Indians aren't adhering to COVID-19 precautions. And I think certainly in some instances that is a factor. But what doctors are saying is that this has been the case since June. and that we've, as you say, we've seen a sudden huge increase from mid-February by 6 or 7 times in daily cases. And there must be a new factor, there must be a new additional reason.
Absolutely.
And the sudden emergence of the variants would seem to indicate that this could be it.
Right. So would it be fair to say, Joe, at this point, that the conclusion from your report really, which is quite an exhaustive report from Nagpur, seems to be that the time has come that we open vaccines for all, that young people in the country also need to get themselves vaccinated, because while we are protecting our most vulnerable lot, the spread of the virus and breaking the chain will only happen once the younger lot gets it.
Absolutely. I think that one of the key takeaways from speaking to doctors in Nagpur was that they're desperate for everyone over the age of 18 to get the vaccine, and they say that people who are spreading the virus most, kind of unwittingly or unknowingly, are those between 18 and 45 who perhaps haven't developed symptoms and are continuing around their life as normal, going to work, meeting family members, and then passing on the virus to those who are more vulnerable. So doctors are urging the government in Nagpur to open up vaccinations. That everyone, so all of those over the age of 18. Many of the hospitals that we visited said they were only operating about a third or half of capacity of vaccinations, because those who vaccinations were open to at the moment simply weren't filling all the appointments. So they were saying, rather than letting these appointments go to waste as such,
right,
let those over the age of 18 sign up and take their vaccinations.
All right, Joe, we leave it there for the moment. Thank you so much. And I know you're in quarantine right now because you were so supremely exposed inside the ICU. So good luck with that. We'll catch up again and see what more is to be seen in all these places. That was Joe joining us from The Telegraph. He reports on health and hugely celebrated journalist there. We're going to slip into a break, but on the other side, we'll be joined by Professor in epidemiology from Bengaluru, Professor Babu joining us, and also Dr. Avinash Unve from Mumbai will be joining us, and we'll take a couple of key points from what we just discussed with Joe on what he's seeing in Nagpur and the new variants come up, and has the time come that India really needs to amp up its genome sequencing to understand really what's happening. That's on the other side. Welcome back. Now, more and more growing evidence is coming out in different reports, not from the ministry, mind you, but people who we speak to on the ground who are talking about a new variant really being the key reason behind the surge that we are seeing in cases across the country. Is that the case? Is India prepared for that sort of level of genome sequencing is what we will talk over the next few minutes. Let's get in Professor Babu on that first. Professor Babu, India at the moment, just to make our viewers understand that, is sequencing only 0.1% of the total positive cases in the country. That by any standard is not enough. What exactly is the requirement right now?
Yeah, thanks Sonal for having me on the show. The government has announced that at least 5% of the samples should be sequenced. I mean, that's the stated policy of the government. I think towards that there is a greater scope, but more than just the numbers, what we need to understand is the matching of these genomic sequencing results with the clusters. So that is the most important because if there is a new cluster happening and then the genomic sequencing occurs, then we need to establish whether it is because of the new variant of concern or not. In order to do that, two tests we need to do. One, in vitro testing to see whether this strain is far more infectious than the earlier ones. Two is establish in the contact tracing whether there is more infection among the primary and secondary contacts compared to the earlier strain. In the absence of these two additional investigations, it's very difficult to say whether it is more infectious or not. We will simply end up identifying a strain which is not really of great value later. So what we need to do is use these results for interrupting the transmission right now and to prevent the spread from one area to another.
Okay. So, Professor, at what level are these tests done to understand that? Are the 10 institutes which are doing genome sequencing across the country, are they to do it or they to happen at state levels?
The 10 labs which are doing, they are the ones who should have additional facilities. But as far as I know, I'm not a lab person, but as far as I know, they too do not have the resources and the bandwidth right now in terms of conducting additional in vitro testing. So far more resources will have to be allocated just to do something like in vitro testing of infectiousness. In addition, to do contact tracing and establish whether the newer strains are a result of that, for that we need a lot of workforce who will do contact tracing. Currently, the health workers are busy in terms of doing testing and vaccination. They can't be again given the responsibility of doing contact tracing. So this combination of epidemiological investigations with the clusters investigated for genomic sequencing and understanding in vitro testing, all of them are required concurrently, Sona.
Okay, very important points over there. I really hope the government is listening to all of this right now. Let me also bring in Dr. Avinash at this point. Dr. Avinash, when I spoke with Joe and he's worked extensively in Nagpur, his analysis seems to be that a lot more younger people are now contracting this new strain of the virus that seems to be the key behind the spike in Maharashtra at least. Is that something that you are noticing in your hospitals and in your patients as well in Bombay, for example?
You're right. When this second wave began in the midst of February, it was well observed that usually the cases which we have been diagnosing were the age group of 20 years to 45 years. It continued till the first week of March, but now after that, what we are observing that as the number of cases are increasing, the senior citizens, the patients above the age of 60, as well as those with comorbid conditions are also increasing. Even the children are also getting infected, and this is quite expected because all these 20 to 45 years old people, they are the earning people, and they were going out. These were the people who were going out, they were mixing in the crowd.
When you say children, you mean what age bracket exactly?
Yeah. Recently, it has been observed that the children below 10 years are also getting infected.
Oh, really?
Even there is a report from Bangalore that the number of cases in children below 10 years is increasing like anything. They have diagnosed around more than 472 cases. And so it has been increasing even in Maharashtra, in Mumbai, in Pune, all over the number of children, the cases right now
and when it comes to children, there is no vaccine either here. So the only way of protecting them is sort of vaccinating our middle order.
No, the problem is the schools are closed, the children are at home, they are working, but the age group which is going out for their earning, they come out with the infections. And these children get infected by that way. And many of the children they have some congenital disorders or some comorbid conditions also. And because of that, they become serious. So the main point is that because of the less contact tracing right now, the 90% of the cases which we are observing are mostly asymptomatic or mildly symptomatic. So it's very difficult to diagnose them because most of the time, even they know that I have been in contact with somebody who has turned positive. They do not come forward and do contact tracing. Neither the government also comes forward. So these people become sort of carrier and they keep on spreading the infection outside also and at their homes also.
So lots of headlines coming out of this discussion really. It's been a very productive show that way. We really need in vitro testing right now to understand what exactly is the capacity of this virus. That's number one. This virus at the moment is spreading to younger people more in the country. That's number two. They are then spreading it to even children, which is a major cause of concern. And number four, really, we need to amp up our genome sequencing and just open vaccination for all, because that seems to be the only way forward. We leave it there, gentlemen. Thank you so much for joining us with the very latest. That's it on the Coronavirus Show today. We'll catch you again later. Bye-bye.